Welcome to our community conversation. And today we are blessed to have Cathie Barton. Cathie has a doctorate. She has a Ph.D. She's also a professional engineer. She is the crisis manager for DuPont Corporation, which is a large corporation. I don't know where it is on the Fortune 500, but it's probably, at least used to be Fortune 100. And Cathie has been immersed in the pandemic since sometime in January. I'll let you kind of tell that story. Cathie's also a personal friend. Her husband and I went on a walk to Emmaus weekend together back in 1991, and then she and my wife Jody did their weekend a month later, and each of us respectively got involved in discipleship groups. So Cathie, we called it grouping. Cathie would group with Jody, and I would group with her husband, TR. We became very, very deep spiritual friends and good friends. We vacationed together. Cathie is also my band mom. She is the leader of our worship band in the church, the United Methodist Church that we attend. And so she tells me what to play and when to sing. And so we get to do a lot of things together. And during this pandemic, I have asked Cathie for advice numerous times on, what she knows, because she's doing, I'm doing this for a camp and retreat center that employs, 20 people or so, and she's doing it for a corporation that employs how many? So Cathie, welcome.
Thank you. And you're going to run my slides, Mr. Jack? That is correct, sir?
I am going to run your slides. So I'm going to.
So while you're teeing them up, I'm going to say the following. It is such a pleasure to talk to faith-based people, because that's not my normal crowd. So hooray. And you all gave me a reason to take a shower. So, thanks on several levels today. So when Jack asked me to talk to you guys, I really tried to put the hat on of people who were either in a church or a camp trying to deal with this COVID situation reopening. So I'm going to give my best shot at translating some of my learnings to you. Please feel free to interrupt me, ask questions, or tell me I'm all wet if you think that is the case. So let me tell you where this started for me. It actually started when I was on a wonderful vacation in Mexico with Mr. Jack Shtama and his wife. And we were enjoying the sun, but I would have to hop off and do calls. I probably did about a dozen calls from Mexico, because the DuPont Company has 13 manufacturing sites in China, one of which is in Wuhan, where this whole thing started. And so I was in Mexico listening to what all these people were going through. Their manufacturing sites were being shut down. They had people trapped in Wuhan who couldn't get out. And in fact, the country leader there was not allowed to leave his home and had to have, the government was delivering food to his doorstep every day. And then I came back home and watched it start unfolding in Europe, in India, all these places where we have people and we have sites. And so what that does, though, is tell you, I had a glimpse of this thing before it came to the US. And so I understood what a beast this virus was early on. And I think that one of the learnings was watching my colleagues in other parts of the world deal with it, help me understand and learn from them, just as we can learn from others around the world in churches and camps. So I'll just point that piece out. The next slide, please, Jack, because I want to set the stage with something that I don't know how you all are feeling. I don't know if you're feeling that everybody else knows what they're doing but me. I don't know if you feel like you're behind the curve, but let me assure you, you're not. We are all in the same boat. And by we, I don't mean churches, I don't mean camps, I mean the government, businesses, academia, everybody. Nobody was ready for this, not a soul. I have people I talk with at the World Bank, Target, Kaiser Permanente, all these places. Any of them who had a pandemic plan tossed it right out the window because it didn't help them a bit. So don't feel like you're behind the curve. We're all behind the curve. That's one point. The other one is every single one of us is figuring this out as we go. I was on the phone with someone from the Delaware governor's office and his public health group. And I only tell you that to say they were saying, we got to figure this out, and we're trying. So everybody is just trying to use their best judgment and logic to figure this out, you included. The third point is flexibility is a virtue. And guess what? You're probably going to change your mind a few times. Don't apologize for it. As new information comes up, change your mind and move on. Last week, we had told people that they could get on airplanes again and travel internationally. This week, we're telling them no, because too many people are saying hot dog, jumping on planes, and we think it's too risky. So we pulled it back with no apologies. Nope, no longer traveling. Too bad. And the fourth kind of high level point is that every decision you make, someone will say isn't far enough. Someone will say it's way too far, and some people will say you got it right. Just know that. I think you people probably live this every day anyway. It doesn't matter what you do with Sunday school or the choir, etc. Somebody's going to be unhappy. Just, thick skins prevail here. So that's kind of the high level piece. Let me go to the next slide for Jack. And this is to say, so presumably all of you are in some stage or some thought about reopening. We started this probably beginning of April, end of March, to write ourselves a playbook for the DuPont Company. So we have, or for the US portion of the DuPont Company. So this was actually well before the White House said we're going to take it in phases. I think it's just common sense that you can't throw open the doors and say, everybody come on in. We've got to do this in a measured way. So we sat down with a small team of people, just as you're probably doing, who had multiple areas of expertise because you need them all. So for us, we had medical and legal, and we had IT people and facilities people, and we all sat around the table and we began to think about how are we going to do this. Before we even started, we decided that the first thing we needed to do was develop what are the guiding principles, and that's to the left, right? Because when you start trying to get consensus on how you're going to do things, you're going to have disagreements, and it's great to be able to go back to something that you've agreed upon from a principle standpoint to say, well, let's remind ourselves what we're trying to achieve here. And I think for yourselves, you're going to have an additional guiding principle that probably speaks to your mission, achieving your mission, connecting people with God. We're an evil corporation. We can't do those things. So we came up with these three, though, that have served us well. And they're simple, but they're very helpful. And the first one is you're trying to get people to be healthy. You want anyone who walks in your door, your campsite, your property, to the extent you can, you want to assure they are healthy walking in. The second thing you want to do is once they're there, you want to keep them healthy, right? So you do everything you can to make sure people coming in are healthy, people there stay healthy. And then the third thing is if you have the unfortunate circumstance of having someone come down with this disease, you got to have an action plan. I can't emphasize enough how important this is, because when you're in the moment, it's not the time to figure it out. And you could have, the chances are probably slim you're going to have someone passing out on the spot in your facility. However, if they did, you would need to know, do I have a room to isolate them in? Do I have contact tracing, names of all the people here, who's going to do the contact tracing, et cetera. That's one scenario, but another one is that someone has come to your office, your service, your camp, and within some period of time comes down with the disease. You have to have an action plan for that too. If they've been away from your church, let's say for more than a week or for 2 weeks, you don't have to do anything. If it's been about a week, you're still going to have to do contact tracing, but you probably don't have to disinfect the place because the virus isn't going to be alive that long. If you've got somebody who in the last, say, 3 to 5 days has been on your site, you're probably going to have to quarantine people, et cetera. So I'm not going to solve that for you today, but I'm telling you to get someone with a medical background to help you have that plan so that you're not trying to figure it out if it happens. And hopefully it never does for you. So let's look at these phases, because I think there are analogies for each of you, although this isn't going to be mirror image to what we did. There maybe are some insights here. What we did was, starting in mid-May, we hit phase 1. Phase 1 was 100% about getting the facility ready and planning. We weren't opening the door to anyone who wasn't helping us get the facility ready. And what that means, putting up signs, getting hand sanitizer, etc., all that. We certainly weren't going to serve food or coffee or anything during those stages. We weren't going to let visitors on, etc. That's the point in time where you want to make sure you know for the next phase who you're going to let on, when, and how. It's really an important road mapping stage, and that took us several weeks to get down. That just this past Monday, we entered what we called phase 2, and this is for offices in Wilmington. This is my primary example, where we said we're only going to let 50% of the site capacity on here, and up to that. We prefer more like 30 to 50%. We're not going to allow food. We're still not going to let a visitor on unless they've been pre-approved, etc. And then phase 3 for us will be only up to 80% of the population back. And by the way, we don't know when that is, and we're not apologizing for not knowing when that is. You'll know when we know, is what we tell people. And I think it's the other important thing to point out is this phase 3 we have still only goes up to 80% occupancy, because there is a world in which we never get to 100%. There is a world in which there are some people who just continue to work remotely, period. And so again, this may not be mirror image for you in how you're going to do it, but I would emphasize that a really strong planning phase before you open a single door is going to help you. And then just being ready to not make longer term decisions yet. I sat actually in our church meeting where people were dying to say, well, we'll be letting them in, and let's have a date. And I said, you don't have a date yet. So don't have one, and say, this is what we're going to do for the foreseeable future. So that's kind of an overarching look at the how we thought about it. I thought it might be important, though, as you figure out how you're going to keep people healthy, etc., that we look at a few of the facts about this virus, because it actually drove some of our thinking, and it might be helpful to you. So these are, as I call them, the pesky facts, because this thing has been so politicized. I mean, you guys probably know this well. People are lining up in face coverings aren't needed. Yes, they are. No one can touch anything. And let's put all that aside and look at what we know and what we don't know and how we should react. So if you look at the CDC guidance, it will tell you that a significant portion of people, and this is actually 50%, half the people out there walking around positive for COVID are either asymptomatic, meaning they are never going to show a single symptom, or they're pre-symptomatic, meaning that they're fine today, but in 4 days, a week, whatever, then they're going to start showing symptoms, which means that somebody can look and feel perfectly fine and be a hotbed of contagion. So you've got to think about that as you were inviting people who look very well into your space. So how do you protect against that? The next slide is, Mr. Jack, is to show you. So churches, the churches I've been to have some very common elements. In addition to saving souls and praying, there's lots of coughing, sneezing, laughing, mouth breathing, singing. All these things that are represented on this slide happen in a church. So these are MIT photos, and I think they're just geeky fun. The top one showing when somebody coughs, I mean, the aerosols flying out of their mouth, 70 centimeters is about 2.3 feet. So 2 to 3 feet when you cough, spewing stuff. Down in the right-hand corner, sneezing, it travels the same distance, but even more. All these aerosols just chunking through the air when somebody sneezes. Just talking to someone for 5 minutes, it's the same as coughing. Mouth breathing, we all know a mouth breather, right? Mouth breathers, people who laugh, those aerosols are going 3 feet. And then singing, I just put "don't get me started," because that we have all heard over and over about the choirs that have massive numbers of people being having the disease transmitted. So the point is, all of those things happen within at least a 3-foot radius. Therefore, the 6-foot social distancing is not arbitrary. People are setting that standard for honest to goodness science reasons. And I think the bishop in our area has said 7 feet. More power to you. Let us really social distance. It's not political, it be science. So, and those are the reasons. And the next slide answers a question about, does this stuff live on surfaces or not? Yes, it does. It does. So for wood, lots of us have wooden pews, we have pencils we handle. Virus is going to live on those things for about 24 hours. Stainless steel, if you have those stainless steel seats, you got 3 days, it's living on those. Plastic, 3 days, and fabric, it's still unclear. But I think it tells us for making sure that we are keeping people safe, cleaning surfaces is actually a very important element of this. And the next slide, Jack, is so what does that lead us to think about? Let's talk about face coverings, which some people are violently opposed to. They actually work to some extent. They're not perfect, but in addition to social distancing, they work. There's a nice little curve there that shows that the countries that weren't wearing masks, so US, right? UK, Italy, Spain, they had a pretty steep trajectory of the disease, whereas the countries that traditionally wear masks and immediately had them donned, in the Asia Pacific, mostly Japan, Hong Kong, Korea, South Korea, they had a much flatter trajectory. It's a nice data point to say, that this mask thing may have something to it. And while you probably can't, nor do you want to try to get some of the masks that are either surgical, KN95s, or even general purpose masks that are disposable, you probably can't get them. And I think that's fine, because cloth masks give you 4 to 6 times protection, better than wearing no mask at all. And your people can make them and access them. You don't have to worry about ordering them, etc. Plus, the other thing we like about cloth masks is that they're sustainable, and you get to go home, wash them out, and put them on again. So they're a very good solution. They also, in addition to all the coughing and sneezing and laughing and aerosols that you're preventing from traveling from your mouth out, they're also not getting on the surfaces. So you're adding protection not only for the human next to you, but for those surfaces that have to be cleaned. So the end game here is wearing those masks really is a reasonable thing to do, even though people don't love it. Let me go to the next one, Jack. Okay, so I can pause here and say if there's any question or comment, let me ask before I launch into some of these nitty-gritties on the facilities. Okay.
If you have a question, just unmute yourself and talk.
Okay. Hi, this is Lawrence J. from Rolling Ridge, and I had a question about toilets. I heard something about the aerosol with toilets, with toilet flushing, that the COVID can spread that way. What have you heard about toilets, flushing of toilets?
I have heard that as well. I think that it's true. I don't think it's flying out of the stall. All right, so let's start there. I don't think that toilet flushing is going to spread it in a crazy way around the restroom. But that if you take the right precautions in a restroom, you're guarding against aerosols coming out of the toilet by number one, you're doing some social distancing in there. But number two, you're cleaning down your bathroom several times a day. I think that is your best guard against it. I don't have the data for how far it travels, but again, I don't think it's really, really far. Did that help?
Yes, it did. Thank you.
Okay. And as an aside, I didn't put it in here, but we had some people do a HVAC. We have an industrial hygienist and some real experts in the field create an HVAC document on COVID that I'm happy to circulate. We have an external version. So if your people want to look at, you know, fresh air intake versus, you know, well, I won't even go into it. There are so many graphs on this thing, it'll roll your eyes, but there might be some guidance that's useful. And if so, I'm happy to give it to Jack to circulate to the group. And it does, I think, hit some of the questions like we're just asked about restrooms and aerosols, et cetera. All right, let me premise this by saying the following. We have 35,000 employees globally, most of whom worked through the entire thing. They were considered essential, and they you know, a small portion of them in offices and laboratories sat out, worked at home, and are now coming back. And that's the group I'm working to bring back. But most of them actually remained there, and we applied some of the logic you're going to see for those people. And I'm happy to say less than 100 people ever got sick. So I think less than 100 out of 35,000 says that there were some practices that were working. Not rocket science, not inventing a new thing here, but just applying some principles over and over. So I wanted to share a few of the learnings with you on this piece. The first one, Jackie, if you go to the next slide, the first one is about pre-screening people entering the site. And I think every single state in the US has something about pre-screening your people. Yes, sir, he's doing this. Can you go to the next slide, Mr. Jack? Is it stuck? Might be stuck. All right. And I can't hear him. Can you guys hear me? Okay. I'll keep talking while he's figuring that out, because I know what's on the next slide. It's about, so I know our church is wrestling with, do I get an infrared thermometer and shoot people as they come in the building? How should I handle this? And our experience was we have some sites that did that. There you go. Found it.
Yeah, I got disconnected audio-wise. I'm sorry.
Oh, that's right. Thank you.
Yeah,
Wait,
I'm back. Yeah.
So some of our sites are doing temperature scanning. They're hitting delivery people and employees, et cetera. And you can do that, but we came to the conclusion that it's not mandatory. It's really not the be all and end all. It's not a fail safe for determining that everybody who comes on your site is going to be healthy, because of that pre-symptomatic, asymptomatic stuff I said before. Half these people aren't showing symptoms anyway. So do you need to go to the trouble and expense? And you know, it's kind of an awkward, it's awkward taking people's temperatures as they come on. We had delivery truck drivers who said, you're not taking my temperature, I'm out. I'm just not delivering your stuff. And it was very awkward. So we decided for most of our sites, we're just going to have a 3-question survey. I'm sorry that I couldn't get that logo off there. It's obnoxious, but there sits the DuPont survey. And we asked them 3 questions. In the past 14 calendar days, have you been in contact with anybody who's been diagnosed with this disease? Secondly, do you have a temperature above 99.5? Thirdly, do you have flu-like symptoms, including persistent cough or respiratory distress, right? Easy stuff. Telling people in advance, you're not coming on my site until you can answer no to all 3 of these questions. If there's a yes here, we're going to ask you not to enter my site. And importantly, you don't want to collect the data, and that goes for if you decide to do temperature screening as well, because it's considered medical data, and you just don't want to mess with it legally. It's an honor system. Yes, you know, my answer is no to all 3 of these. You may enter, kind of thing. We just posted the thing on the front. We had guards verbally check them. So that was our solution to this. It's maybe simple and elegant. We actually did create an app for it later, but this worked just fine for 6 weeks or 2 months. The next slide was.
I have a question.
Yes,
Can I ask?
Sure.
Yeah, I was just wondering, did you ever do a lot of testing?
No. So that's a really interesting question. There is one of our sites that had one of the rapid test places conveniently located about 2 miles from them. And for any individual who was coming down with it, who was coming to the site saying, I'm not feeling well, we said, you know, go get a test taken. But we decided that first of all, administering it yourself, you're going to have a swab, you're going to swab someone, you've now got a medical waste. So you got to deal with that as a medical, it's saliva, it's a bodily fluid, you've got to bag it, you've got to do it. It's just too complicated to do it. So we decided to leave it to the professionals. There's also a question of whether an individual chooses to test or not. And, even in a work setting, they've got a prerogative to say, no, I'm not going to get tested. So we decided to avoid all of that and leave it between them and their health professional.
And so that questionnaire that was on the last slide, how far into this did you start implementing that? Like, was that after the shelter in place, or?
This was maybe March 1, way early.
Okay.
Because this is the advantage of having people in Asia Pacific who had already gone through it. And they said, it's a survey. And notice there's nothing in here that said, have you been tested for it? It's saying, have you been in contact with someone who's been sick?
Okay.
Yeah. And there is a gray area between somebody who's suspected to be ill but chooses not to be tested. That's a very tricky area. So you kind of assume they have it if they have the symptoms and operate accordingly. Quarantine 14 days, disinfect if it's been within a 5-day period, all of that. That's how we did that, like err on the side of conservatism.
Right, because even the testing has been controversial as far as the accuracy of it. So yeah.
And that antibody, so there's diagnostic testing. Do I have the virus? And there's antibodies. Is there something that appears that I have it and have had it? And we have a very gung-ho chief medical officer, and she was like, I can get 100,000 antibody tests. And I said, why? What are you going to do with it? Nobody knows how to interpret it. And we all said, yeah. So antibody testing, I think, is a TBD.
Is what?
Is that to be determined, whether it's whether it's whether it's useful and how. When I say the testing you and I were just talking about, I was talking about the diagnostic, whether I'm positive for the virus, have it actively.
Okay. I don't want to take up all your time, but that's a great rate of only 100 cases. I was curious, do you know where that outbreak, was that one outbreak, and did it happen at your facility, or was that somewhere else? Or
so the 100 is globally. The greatest number we had at any single site was 15. And that's a site of, I think they have 1,000 people, hundreds, if not 1,000 people. They have 15, which we consider a terrible outbreak. It's awful, 15, but it's not good, but it's still a pretty good rate.
Yeah. And were those 15 folks within, close proximity of each other, do you think?
Yes, within the same unit or two. Yes.
Okay.
Yeah.
All right. Thank you.
Sure. I'm just going to flip through some things we thought about from a facility standpoint, and it's just to prompt your thinking about things for you to think about. So one of them is your cleaners. Their EPA has a list of approved cleaners, and I would recommend that you look at that because not everything works. And so go with the stuff that they recommend. And hand sanitizer all over the place. I think the church guidance is saying that anyway, but it's really a good idea, placing it in high traffic areas. So the next slide is just a disgustingly detailed enhanced site cleaning guide for you to look at your leisure. And it's to say cleaning is a real deal here, twice a day, 3 times a day, depending on, now what's different here is we are having people on these sites all the time. Maybe you have a once a week thing, I don't know, but just to have your people think hard about how often you clean and what you clean. Elevator buttons, handrails, these things are a big deal. And Jack, if you circulate the slides, you guys can stare at it at your leisure if you choose to.
I had another question about that, sorry.
Sure.
I can't really see it, but are you relying on folks that work there to just clean up after themselves, or have you hired people to just clean all the time?
We hire people to just clean all the time. We have janitorial services that, you know, here you go, and they are walking around the site cleaning, and then they start again, and their entire job is cleaning. Now, we do encourage people as they come back to offices, clean up your own surface, wipe your own stuff down. In addition, feel free to bring your own wipes. We'll make them available if you want. But we are relying on the professionals to really get down and get dirty here, if you will.
Okay, and do folks wear masks at your facilities?
They have to. They have to wear a mask unless they are alone in their office, or we have conference rooms set up, social distancing, you know, 6 feet apart, et cetera, wipe down. You can be in a conference room if you're doing that in your office. That's it though. Bathroom, walking between buildings, don't care if it's outside. It's all about the routine and the optics of keeping those face coverings on.
Okay.
And they don't love it at all. They don't.
Yeah.
Yeah, it's things to think about. You probably have seen these in the grocery stores, but these guard shields are kind of a nice idea. If you have a reception area, we put them up there and put the X's on the ground. The next slide for me, Jack. I'm gonna kind of roll through these fast. So if you have elevators, think about it. You gotta wear a face covering in there, and you gotta social distance in the elevator. That is a close and confined space. We've done for hallways and stairwells, we've done a one direction thing. So if you're going up, you go up this. If you're going down, you go down that one. If you're going up a hall, that kind of thing, just to keep people from coming in contact with each other. The next one is eating areas. Yeah, all right. So this, you know, churches love to eat. So this is gonna be a tricky one for you guys. For us, we did this dining area configuration to really pull apart and this is, by the way, we're not even allowing this yet in our offices. This is a phase down the road kind of thing when we open the cafeteria. But we're gonna really social distance at the tables. We're not allowing common use of a refrigerator, no ice machine. Of course, coffee pots, gotta have them. And traditional water fountains. That's, you know, you want to put a big ixnay on the water fountain because bending down and, you know, yikes. You don't want to do that. If you have a water cooler, that'd be great. People can bring their own containers or have disposable cups. That's how we went. Next slide, conference rooms. Just think about setting them up, pulling out the number of chairs, too many chairs so people can't get too cozy if you're opening your conference room, your team room.
I have a question.
Yes, ma'am. Ann.
In your
office?
Small refrigerator, a mini fridge where people may come and put water bottles in. What has been your experience with that?
So we don't have mini fridges, but we do have common area refrigerators, and we've said, no, bring your own cooler for now. We don't want your mouth stuff merging with anybody else's mouth stuff. It's just an utmost of caution right now.
Good point. Thank you.
Yeah, sure. Okay. The next one, I only have a couple more of these, just triggering thinking. Yeah. So I'm assuming that everybody's probably got an office in their church or campground, and so thinking about those office workers differently than your people who are coming to service or people that are at camp is important. Thinking about, you know, can some of you just work from home for now and let's just dodge that bullet? If you can't, we've gone to Monday, Wednesday, Friday teams and Tuesday, Thursday teams. So you can come in the office, but we're gonna make sure we're keeping capacity down. Staggering their work times, we're doing that. Staggering their seating if you have an open office. So you know, if you have 3 cubicles or 4 cubicles, let's put them at either end and not fill the 2 in between. When you're at the copier, in the restroom, social distancing there. And then this is the piece where encouraging people to wipe down your own desks. People are doing it for you, but do it for yourself as well. We can't be too careful. So the office, just encouraging you to think about your office workers a little differently, and wiping down their phones, by the way. So the last thing was just as we launch into the future, the whole what's next. I want to say that people keep saying, you know, we'll reopen when there's a vaccine. Well, golly, guys, that's probably 2 years out. It's going to be great when we have it, but we can't stop living until then. So that is the best case, agreed, but it's a while down the road. Next best case is if you get this disease, can we treat you? That'll bring blood pressure down as well. But that's still, and this is a best guess, at least 6 months till we can get something that is gonna fix you if you get it. So really where we are is this current risk management. That's where we all are, and we're gonna be probably till the end of the year. So for the foreseeable future, you're gonna have to take some measures, in order to get back to some kind of worship or camp experience. You're gonna have to have some kind of enhanced hygiene, face covering, social distancing built into your day. And then some people are going to choose to test and trace. We're not going that direction, but others will. That's going to be out there as well. I think this is really that bottom piece. That's what the future looks like for the next little while, is my opinion. So that's all that I have. Any questions or comments from you or perspectives from you?
Yeah, I have a couple of things. One, you and I talked recently about wearing masks outside, and I know you said at your sites you want people to wear masks between buildings, just partly optics, but partly also just keep being used to keeping them on. Can you just say what you know about the difference between inside and outside transmission and what that might mean for outdoor church services?
So I don't have the data in front of you, but I do know that the outdoor transfer is not as bad as the indoor. And I'm not exact, I suspect, because you do air modeling, right? I suspect it is because you have a lot more movement in the air outside than you have inside. Inside air just doesn't move as much as outside air. So you're not going to have a direct transfer to Jack as I'm talking to him as much. Things are going to be blowing around. You've got sunlight, you've got humidity, you've got other factors working in. I will say that one of the other reasons for having people wear face coverings, or one of the parameters for having them wear face coverings between buildings, is because it's just a short walk. They're not having to do their camp activities, and so I think you have a different point of view there, Jack, where you've got kids and you've got people trying to have their day and go about their daily business with a face covering on. That is a much harder deal than having me say to a grown-up, when you walk from this building, 1,000 yards out, put a face covering on. So it's not all the science that's driving me to do it. I think the science gives you a way to allow people not to wear coverings outside, especially kids. Hi, Neil.
Hi.
Yeah. Hey, Neil. Before Lawrence. Neil, Lawrence had his hand raised, so I'm going to go to Lawrence next, and then to you, Neil. Okay, go ahead, Lawrence.
Sure.
Yeah.
Thanks. Sorry about that. I just had a question about the coffee service. I know that you had mentioned that you're not barbarians, and so you're allowing coffee to be served. But for our retreat centers, there is the concern about using like the air pots and so forth, because there is that sense that if someone's using the air pot, then the next person goes and uses the air pot. Is there, I guess, concern about transmission doing that way, or even someone is pouring a cup of coffee and then they go and they use that same handle, is using hand sanitizer enough? How are you monitoring that coffee service in your facility in that way?
So you're asking a question that I haven't delved down into. I know we are doing it, I just don't know the details. So you're bringing up exactly the right points. They are touching the handle. You've got to have hand sanitizer. I would say maybe a glove. You could have a glove, you could have a hand sanitizer. You've got to do something to keep that common place where everyone's touching clean. And you know what, I'll ask my facility guy that started this week how he's doing it, because I didn't ask that level of detail. But you are correct in that it's not a free-for-all at the coffee pot. You still have to social distance and take all those right steps. So I'm going to write down to get that information and have Jack send it out to you, okay?
Yeah, then I'll post it in the network. Go ahead, Neil.
Okay, so I'm thinking about, outside worship service.
Right.
So where the pastor, myself in this case, would be, distance from the rest of the folks that are sitting, also distance, in groups. But then, I would be needing probably a microphone. We're going to have a microphone with a couple speakers set up. So I'm planning on wearing a mask to that point, but then taking it off to be able to speak openly. But then also have like a hand wipe, a sanitizer wipe, to make sure that the microphone and anything that I've breathed on or touched is cleaned up when I'm done with it. Because I'm not going to be the one taking it down and all that. Does that make sense?
Yeah. Well, I think that's exactly right. I think you're right. Practically speaking, you can't wear a face covering and talk. I mean, that's why we have in conference rooms, you're going to social distance. You're going to talk to them for an hour. The fact that you have a sound system is your friend, because you can back up 12 feet from these people if you have 10 feet or a good amount. Have your sound system going. Take off your face covering. Do your talking. And you're right. I would suggest. I would suggest somebody wipe down the mic stand, and I can't recall these mics if they have the foam covering on them or if they're metal. But if they're metal, I would wipe them down. If they have the foam covering, you could probably remove it and wipe it down. But we got to figure out a way to clean those foam coverings, and maybe we just get some more and throw that one out. Because I think there should be dedicated microphones going forward for any singer, for any speaker, for the next 3 months or whatever, or maybe forever. That's Neil's mic. Nobody uses Neil's mic but Neil. I think that's where we're gonna land, depending on and some of it depends on the configuration of the mic, though, how we clean it.
Yeah.
Debbie, did you have your hand raised?
I was wondering if you could share with us the protocols that would make sense for if an employee comes in with symptoms or a retreatant develops symptoms while on retreat. Because in my state, headache is one of the symptoms that the state has designated, and I can see retreat coordinators, getting a little bit too overzealous and isolating somebody and sending them home because they have a headache. So if you could share maybe just what are the practical good sense protocols for that sort of thing?
So I think that no one is saying one symptom indicates COVID. So I think that you can set up with your group, you can set up agreed upon criteria, which would include 2 or more of the following, right? So 2 or more, and maybe headache is one of them, but a headache by itself shouldn't send anybody into a headache with a 99.5 degree fever. I'm going to start thinking about it, right? So set up your criteria for what constitutes a suspected case, agreed upon, perhaps. Ultimately, the best case would be to have it blessed by a medical person, right? So you got that. Then you've got, if I've got that person in that situation now, are you talking about a child?
About a what?
A child or an adult?
Adults. We deal mostly with adults.
So I think there's almost a decision tree approach here. If you've got someone who's coming down with something, then they can drive themselves home, right? They can leave, and I would have them leave as quickly as possible. And then you've got to, so the big question is now, you have to assume they have it for the moment. So the areas that they've been in, you're going to have to sequester people, keep them out of those areas. If you really think they've got it, you've got to initiate contact tracing. Now, in a lot of states, that is something that the Department of Public Health does. That's not up to you. So I think you need to know who does the contact tracing in your area. And you have to be able to collect the names of the people that person has been in contact with. So you got to be initiating that. What we would do is immediately begin to disinfect the areas the person has been in, just as a matter of caution. If we had someone, for instance, in a manufacturing site that came down with it, we send the unit people home We say you're going to 14-day quarantine until we know this person does not have it. We're going to sanitize the whole area, and then nobody comes back in this area for at least a few days. And then when the people for the 14-day quarantine, if they come down with no symptoms at all for 2 weeks, then they can come back. It's not a pretty picture. It's a pain in the neck, to be honest with you.
Well, especially because we like, I only have 5 cooks, you know,
Yeah.
and it requires 3 to do a meal. So.
Yeah, and so so if you have a 3-person shift at any time, you at least have 2 people who will not have been in contact. And I would dedicate them, by the way. They are a dedicated shift. Don't shuffle them around.
Mm-hmm.
Yeah, you've got a 3-person dedicated shift and a 2-person, and you need, I don't know if they can handle it by themselves, but so now if one shift goes down, you've got a backup shift.
Mm-hmm.
Let
If
me
you
think
can.
more.
Yeah.
Yeah, if you can.
Yeah.
Yeah.
And I guess what you're saying too, Cathie, is absent of tracing. I mean, of testing. To some extent, I think if you can get people tested, it can shorten that timeline. We had our camp nurse was giving us guidelines. She works at Children's National Medical Center, and they require 2 negative tests within 24 hours. They don't believe 1 negative test because they get too many false negatives. So
we wrestled with that guidance because that guidance is actually for health workers.
Right.
And we, you know, because we're a business, we said one is fine, because now that's 3 more days that you're out while I have to wait for the second test to come through. Right. But so that to me the second test is discretionary. The first one, though, absolutely. If the person's willing to be tested and their doctor will recommend it, they get the test, they come back negative, hurrah, and then everybody goes back. That's how we run it. But you know, you might do it with the second test.
We had an impassioned discussion yesterday in a staff meeting about whether we can require guests to wear masks. And Cathie, I didn't mention that Cathie's a frequent guest at our retreat center because she's involved in the Walk to Emmaus community. And, you know, we decided that we couldn't require guests to wear masks, that we could strongly encourage them. But I'd like to know your opinion, Cathie.
So yours is this a guest or a customer? I mean,
a customer, yeah, guest customer, yeah.
All right, well, this is where I come out. It's not going to be popular. If you're on my site, now go back to guiding principle number 2. My guiding principles make sure everyone, including you, Jack, and your staff, and everybody stays healthy. In order to do that, I'm going to, under certain circumstances, ask you to wear a mask. If you're in your room with the door shut, that's fine. If you're outside social distancing, meditating, that's fine. But if you're in a dining room with anyone, if you are in my common area, I need you to wear one. And if you aren't going to wear one, I need you not to come. Now that's problematic because it's now you're losing a customer. But
right.
For the time being, that's how I would agree.
So, and we did decide we do require our staff to wear masks, and we talked about, you know, because some guests we just believe are going to not wear masks. I mean, yeah, I mean, how many times do you give them before you kick them off property, or, you know, do you say it's required? Do you say it's strongly encouraged? These are, I would love to hear actually pastors or retreat people, you know, what you're thinking on this when you're talking about either, you know, congregational worship or retreat groups.
Well, we had really early discussions, and you know, centered around someone walking in the church that would refuse to put a mask on, and you know, again, haven't reached resolution yet, but consensus seemed to be headed toward that day we would just not have church. Everybody would walk out rather than accept someone without a mask in a service. So pretty dramatic, but
Yeah.
not a lot of options, a lot of discussion, not a lot of options.
It's a show of surrounding togetherness pressure. Todd.
So I was in a conversation with our bishop, and it was focused more on local church material because our bishop has produced guidelines for churches to reopen. And she was pretty adamant that people wear masks at worship through the phases that they've set up, in part for the community to come to understand that there are people who are bullies or abusive, and you need to stop them from carrying that behavior out. And so it was an interesting, for me, insight into where the bishop was. And I think from the standpoint of camp and retreat ministry, I'm going to side with your guest here that we need to be clear. In these areas you can be without a mask, but in these areas you need to wear a mask and keep people healthy. So
Mhm.
Anyone else? Any other questions?
It goes along with that, because I know the regulations from state to state are varying from week to week. So and my premise is, be as helpful as possible. If we're Christians, to be as helpful as possible, mindful and considerate as possible, trying to, not only stay healthy ourselves, but to, facilitate that and to do no harm to others, or even risk the harm. So if we can wear a mask, that's not a terrible inconvenience. So I might even get a little bit, used to it. So my question is, like, within buildings, what is the current regulation, let's say in Maryland, regarding people going into stores or churches? I thought that I knew that the workers had to wear masks now, but isn't that true of customers also, or not? Like going to a supermarket or something.
I don't know Maryland. I'm a Delaware lady, and we still have to wear them. I mean,
Yeah.
Right. So I thought it was up in Delaware because that's where we're living now too. So I thought for Delaware, that was required.
It's still required. It's mandatory in retail outlets. I'm not so sure it is in like office spaces and things like that. I think that's up to the employer. So, and going back to the question I asked, I certainly believe we have the right to ask. I mean, we have the right to require it. And so we're trying to think about language required versus strongly suggest versus, that kind of thing. It's kind of like we have a no alcohol policy, but, we also know that sometimes people violate it. And so we're always trying to figure out, how you manage that in a way that communicates hospitality. My big concern is actually having people in our meeting rooms because they don't have high ceilings. They have recirculating air. And if they're going to be sitting in there for, an hour or two at a time, I think they should be wearing masks. If they're not wearing masks, they're putting themselves at risk. And so, our debate is whether or not we're going to kick somebody out. And what that means for Walk to Emmaus, because they don't like to follow our rules a lot of times. So.
Well, our original guidance for the site people was we were going to strongly encourage masks, face coverings, and then just like I said at the beginning, we changed our mind. Too bad we changed our mind. Mm-hmm. The more we just got, it was too loosey goosey. It was too. You can wear them if you want. We're like, you know what? No, you come on this site. These are the rules you follow. I'm done because I don't want to be responsible for somebody it's not because it's not one person. It's everyone who's been in contact with them and all of this stuff. So, it's hard. It's hard to be a leader.
I was just going to say in New Mexico, it's required in public for everyone. But Texas is right next door to us. And probably 3/4 of our groups are people from El Paso, and they're not requiring it. So we had to make a decision that we were going to require it and just let our group leaders know ahead of time that that's what we were going to do.
That's a key point, and it's probably a good note to end on, is communication is everything here. People may or may not agree with you, but talking to them about what you decided and why you decided it really goes a long way. So good for you.
That's a great point. And you nailed our 2 o'clock time frame. So thanks so much, Dr. Barton.
You're welcome.
Yeah, so I have recorded this, and I'll upload it to the network. I'll also upload the slides. The one cleaning slide is really, I really like that one. Well, if I have any other resources, I know Tom Pasmore asked for the one on airflow or whatever it was. The geeky.
Yeah,
Yeah,
I'll send you a
yeah.
couple things.
I just want to see the charts. Sorry.
Yeah, Tom is a former DuPont plant engineer, so that's why he wants to see that stuff. So.
Oh no! Oh no!
Yeah.
All right,
All
he'll send me corrections.
Would anybody like to close this in prayer? I don't think I opened in prayer. Anyone? Raise your hand. Come on. I feel bad because I put somebody on the spot last time.
I'll do it.
Thanks, Tom.
Let's
DuPont
pray.
engineer.
Yeah, that's right. Oh, gracious God, we thank you for this opportunity and this time. As we seek your guidance and your grace in the midst of all that we have going on in our churches and in our world, we just thank you for your gift of reason that comes to us fresh and new as we seek insight through knowledge. And so we just ask you to allow us to help put that into practice in each of our contexts and to invite your spirit to guide and direct all the actions that we take. We thank you for just Cathie's willingness to share today and each of our opportunities to interact with your spirit and with one another here in this place. And so we pray that as we go our separate ways, that you are continuing to be with us and guide and direct all that we do in our local churches or camps or wherever. All this we lift up in Jesus' name. Amen.
Amen. Thank you. And for you camper retreat people, just a reminder that at just in less than a half an hour, there is a finance, the first of 2 parts on camper retreat finance. And thanks to Lawrence J. for making that happen. There is a link to it in the network if you haven't seen it, and it's going to be recorded. So it's worth registering even if you can't join it online. So thank you all, and we'll talk to you soon.
Thanks, guys.
All right, bye-bye.